Bouncer?
Yes, do that for me.
Okay, Colonel Leaks?
Here.
Will Mood?
Yeah.
Derek Huggins? So you have a quorum.
Okay, we've determined that we have a quorum. Thank you very much. The next item on the agenda, on the program, is the adoption of the agenda. Can I get a
move
motion?
that we adopt the agenda.
I second. Properly moved in second that we adopt the agenda. Page in the future. Oh, I guess I can say this. Page in the future, what we'll do a roll call, especially at the big meeting. After we adopt, I guess after we make each motion, so it'll be official in the record and everything. Okay. All right. The agenda has been properly moved in a second, and the agenda is adopted. Item number 3, adoption of the minutes.
Mr. Chairman, do you want to just go ahead and just practice and go ahead and do that repeat of the motion and the roll call?
Yeah, let's do that. Let's do that. Yeah, go ahead. Roll call, Madam Secretary.
Okay, a motion was made by Ms. Nude and seconded by Colonel Leaks to adopt the agenda. Colonel Leaks?
Okay.
Aye or nay, yes, sir.
Ms. Nude?
Yeah.
Yes.
Yes.
And Mr. Huggins?
Okay. Not here.
Motion carries.
Motion carries.
Motion carries. Thank you much. All right. The next item on the agenda is adoption of the minutes from July.
I move we
24th.
adopt the minutes as distributed.
I second that motion.
The motion
Madam
reads,
Secretary?
yes, the motion reads, a motion was made by Ms. Mood and seconded by Colonel Leaks to adopt the minutes as distributed.
Okay, properly moved in a second. Now can we get a motion? All in favor?
Aye.
Go ahead, roll call.
Colonel Leaks?
A roll call. Go ahead, roll call. Go roll
Colonel
call for me. Here, I agree.
Yes.
Mm-hmm.
Okay, Colonel Leaks?
Yes.
You said aye.
Oh, I'm sorry. Ms. Mood
Yes.
and Mr. Huggins?
Okay.
Carries.
Okay, the motion carries. Thank you. Next item on the agenda is discussion and action items. This will be led by Mr. John Andor, Corey, and Leroy Deschamps. John, take the lead, please.
Yes, Mr. Chairman, members of the committee. We'll start with Corey Gagnon, or the RATP Dev team, to just update us on COMET operations first, and then we'll talk about vehicle cleaning, food delivery, testing, and COVID-19 policy. Corey from RATP Dev.
Is Corey on the line?
Hi,
John, it's Joe.
Hi, Joe. Are you speaking for RATP Dev?
I don't think Corey's going to be able to join. I'm not sure, or if he's trying to join.
Okay, if you're speaking for RATP Dev, if you can give an update on how common operations are related to COVID-19.
The operations related to COVID is going relatively well. One of the additional steps, and I'm not sure if it was discussed in the previous meeting, but we did put up the other thermal sensor for temperature readings and checking during check-in for the operators on the transit side. That's going extremely well. And again, it's making the announcement if any of the operators or team members aren't wearing a mask. Taking temperatures so far. Nothing to report as, a high temperature reading. During the COVID testing that was conducted by, I believe, Lovelace, we had between 25 to 28 total participants that took COVID testing, including myself and a couple of extra staffers. We have to announce that they called me yesterday to let me know that my test was negative, so that was good. So
Good news.
that means that the results are coming back relatively quickly. Regarding overcrowding and any issues on the vehicles, we have not encountered, except for one where I let the Comet team know. I believe that was run 801, and that was just due to a rainstorm happening, so everybody just loaded up on the bus. Since then, we have not heard any overcrowding in the vehicles. And the team has been, enforcing the mask rule. We have little resistance, so that's on a downward trend regarding customers not willing to, put on their face masks, which is a positive. We do on occasion have unruly passengers, and, we dispatch a supervisor to the location of the vehicle and address it as necessary. Sometimes the passenger needs to be removed from the vehicle. Sometimes the passenger is compliant and the route continues on its way. Other than that, COVID-related issues, we're good. On-time performance has been relatively going well, I guess, because due to the low ridership. And those are sent out daily. So that way Eric and the planning team as well as the comment team can see how we're trending.
Mr. Chairman, I missed the name at the beginning of that report. Was that Mr. Sanchez reporting to us?
That is correct. That is me. Yes, that is I.
Okay, thanks so much.
Absolutely, you're welcome.
Okay.
Mr. Sanchez, if you don't mind, can you also talk about now food delivery and vehicle cleaning and bus shelter cleaning?
Okay. Food delivery, we did have there was a minor hiccup since our last discussion, but that was due to a miscommunication in emails. I guess maybe the email address was wrong for Jim over at TCS, but that's been since corrected. Food delivery, according to Jim, has been trending upward, not significantly, but I believe the last report he stated that they're starting to get a little more requests. Regarding vehicle cleanliness, vehicles are getting fogged, cleaned, sterilized, wiped down. TCS is also keeping a log of the progress. They are currently, their work currently fully staffed. I guess they had a staffer resign not too long ago, so I have to check the status on, his recruiting efforts on replacing that role, that position. And I can let the comment team know. So vehicles are getting cleaned. There's a log that is being kept to make sure that everyone is in compliance and doing as stated in the contract.
All right. Anything else? Hello?
Thank you, Mr. Sanchez. Mr. DeChamps, can you talk about COVID-19 testing and any other COVID-19 health and welfare-related issues?
Yes. Like Joe was mentioning, we did have COVID-19 testing this week done. It was volunteer, and it was done by Lovelace again. We had, and actually I got the results, Joe, back within the past hour or so, so I'll be getting with you guys to get this to you. But we had a total of 49 screenings done, and all of them came back negative. So yeah, what they also do is, like Joe was mentioning, is they start calling, touching bases with people personally, by phone, and also too they'll follow up with sending us the results. So I just got those not too long ago. I just had a chance just now to kind of screen through all of them to make sure everything was okay. So all the results were negative, and we continue to reinforce social distancing, wearing of masks, and also again we always stress to each other about reminding each other to make sure we have on our mask also. One thing John and I talked about, and what I'll be working on, especially going into the next 3 months and the flu season, I will be getting with Lovelace again. And what we're going to do is we're going to have them come out one day a month for the next 3 months. So we'll be promoting that to the employees to kind of keep the focus on safety, and also to letting the employees know that we're definitely concerned about their safety. So I'll be working on that, where they'll come out one day a month for the next 3 months. And we thought that would also tie into with the uncertainty of the flu season. And I think one good thing about that too is we'll already be on their schedule, depending on how the fall goes. So I will be working on that. We also have the temperature kiosk up here on the second floor, which the employees check daily their temperature, and it reminds them whether they're wearing a mask also. So that's been going well. Also, too, based on especially after the screening of this past week, we've made the decision to also open back up our fitness center. Definitely, it will be limited as far as maybe the maximum of 2 individuals that would be in there. We'd also ask them to practice even social distancing in there and wear a mask at all times when it's possible. We'll also make sure that it's being cleaned daily, but also the equipment wiped down after each use by the user. And like I said, we'll limit it, the amount of time that they can, or each employee can utilize it. We'll also set it up on a schedule where it will get fogged once a week to make sure that we're keeping it sanitized and safe. So we're looking at working on that for a target date of September 1st. And also, too, we think by having continuous testing too, we're not losing focus on safety as we look at doing other things, as far as employee satisfaction around the building. And we continue to enforce our COVID-19 policy, quite natural from the administrative building, but also on our buses also. Reinforcing that with our operators and also our passengers, social distancing, wearing a mask, all of those things are still in place going forward. And I think one thing we found out is because we were out front in this, I think we've been having a good safety record as far as just keeping everyone safe. And then our focus daily COVID-19 meetings daily at 4 o'clock also keeps us focused, where if we have to make some adjustments or make some changes, we're able to do that within a very reasonable amount of time. So again, can't overemphasize and thank everyone, the employees here, for their focus and the encouragement of each other doing what we can do to keep everyone safe, and definitely delivering that out on the streets with our operators and our riders also.
Mr. Chairman?
Sounds great. Go ahead, Leo.
I want to thank you for that good report, Leroy. And I had a couple of questions. The testing that we were doing this week, is that a matter of catching people that had not been tested before? Is that what we were trying to do, is fill in any gaps?
No. This was just we felt like it was a good time to kind of come back, and this was more on a voluntary basis. So
anyone who felt like they wanted to be retested could do that?
Right.
Okay. And then the other thing about the flu vaccine. so that on the 3 months, they will come and make that flu vaccine available to our employees on those visits for once a month for 3 months?
Well, this will be COVID-19 testing. It won't be the flu vaccine, but we just thought that this would be a good idea because, going into the fall with the flu season and not knowing what it presents, we felt
whether
like
that would be an extra risk.
our constant COVID-19 testing will be there for employees.
Well, I wondered if we might want to think about if they're there and they come each one of those months, whether we might be able to offer flu vaccine to the employees on those visits, simply because I think about the schedule of our drivers and employees, and sometimes it's difficult to find time to go get that vaccine. And if that's something that we could offer them in the workplace, what would we be getting into there? What would we have to think about to do that?
Well, and I think I mentioned that in our last meeting. They said that's something that they're looking at doing for the fall. I think there will be an additional administrative cost to us to have that done if we do testing for the flu also.
Well,
you didn't. Go ahead.
Well, I mean, to the comment, I mean, I'm thinking about like for those of us who like go into a pharmacy to get our flu vaccine, and then it's covered by our own insurance. I just wondered if that would be the same thing would be true for the employees, that really what we are offering is the convenience of being able to get it at work, and then the cost, the coverage of the cost would be just as it would be if the payment would be just as it would be if they went and got it somewhere else. It's just the convenience of having it there. Now, I'm not advocating this. I'm just saying that would be a good thing, if we could do it, but I don't want to say do it without our knowing exactly what would be involved on our part.
Yeah, pretty much like I said in my conversation with them, it's been a couple of weeks ago. The only cost to us would be they have an administrative cost because they have a doctor, a nurse practitioner here along with other staff, so they do have an administrative cost just for the paperwork.
Mm-hmm.
That would be probably your biggest difference. Is, say, for example, yes, I agree with you for the convenience, but that would probably be the only difference as opposed to, say, for example, if they go to a drugstore or whatever, there's no administrative cost, but they do have an administrative cost, basically because they're a mobile unit and they're coming here and they have staff here. So it's I'm trying to think through the fact that they are already there, so we're already paying for the cost of the mobile unit to come because they're coming to do the other testing. Right.
I don't know what it would be possible to negotiate, and maybe that's not feasible. I just thought it was worth asking. Well,
and that's definitely in my conversation with them. I will discuss that to see, for example, if you're here and you're able to do both, how can we just do one, say, for example, administrative fee to cover both to see if there's a reduction there.
Exactly.
Yeah, so definitely.
That's my point. And what is that administrative fee, Leroy? How much is that?
Well, for COVID-19, it's $50. And I think the last time they said they were thinking about possibly, if it's the flu, 25. So I'll ask them, is there, again, we've utilized them multiple times and things like that, and we're looking at you coming back. So I'll use those things to try to get us a better rate, a better administrative fee.
Well, I would just ask John and Leroy if they would just look into that. No directives, just to explore that possibility.
Yeah, and I'll have that by next meeting. Yes.
Now, let me ask you. Now, that $25, that's $25 per person, right?
Yes, sir.
Well, you know what? I don't know. That's a lot of money just to give somebody a shot.
It does sound like it, but everything sounds like a lot of money to me, so it's hard for me to judge.
That's right. That's right. But I'm just thinking though, it might be to show our concern. It might be easier for us to just load people up on a bus one day and take them down to someplace, Walmart or wherever, and let them get the flu shot that way. I don't know, but that's a good point.
Well, and that may not even be an issue either. Mr. Leaks, it may be that our employees say that, well, we don't really need that. We can stop by our own pharmacy and do that. So, I mean, so we don't want to create a need where there's not a need, but
okay.
Just looking at that, and maybe that. But your point of just checking with employees to see how helpful that would be. How much of a problem is it for them to get to a place to get the vaccine? Because what we know is we don't want drivers out with the flu either, and if we can prevent that, that would be a good thing. So
you're right. Okay. Well, what you going to do on that, Leroy? You're going to check into it, you say?
Oh, yes, sir. Yes, sir. I'll have that by our next meeting, sir.
Okay. Thank you much. Thank you. All right. Anything else to Leroy?
Yes, sorry.
Oh, anything else from John? Anybody? Go ahead.
Yes, Mr. Chairman. I just also want to add that our CARES Act grant has been finally executed. So we are working on an initial drawdown to replenish.
I didn't hear you, John.
I'm sorry. Do you hear me better? Is that better?
A little better. Go ahead.
We have executed our CARES Act grant with STA. So we are now getting ready to do a drawdown to replenish the funds that we've expended since January 20th of 2020 on the eligibility.
Right.
So I anticipate our cash funds will increase significantly because of those drawdowns that we are working on.
All right. That's good. Always getting more money. That's great. Go ahead. Okay. Anything else?
That should do it from my staff as well as our ACP desk on this matter.
All right. Thank you. All right. Good report. Okay. The next item on the agenda is update on the driver barrier and digital.
Yes, I'm sorry. Just one thing before I forget, going back to the last item. Page 6 of your packet has the executive order. Governor still has continued to extend the state of emergency. So, as you know, we are operating an enhanced Saturday schedule per previous board action, and we're still not collecting fares at this time. However, as I've stated previously, we have that fully covered with our CARES Act funding that we've budgeted. So going on to item and I also attached the APTA standards for how to operate public transit during a pandemic. That was on page 16 of your report. They updated that as of early August. So it's for your reference if you have any questions. And then lastly, on page 46 is a webinar that myself, RATP Dev staff participated in related to COVID-19 recovery, maintaining healthy operations, and keeping transit workers safe. So these are best practices that other transit agencies across the country are doing that we can instill into our operations. So that's informational only to read at your discretion, and we'll be happy to discuss those at the next meeting if you have any questions on those three.
Well, John, I wondered if you spotted anything in the APTA standards that we had overlooked or missed or weren't doing, or anything. Did you spot anything that looked like things we should be paying attention to that we're not?
I did not at this time. We were actually a part of working on that document as well as and the update by sharing our information on what we've done with our current practices and our current policies. So I'm happy to say that the things that are recommended are things that we're doing.
Great. That sounds good. Thank you.
Now, this next
John,
agenda item. Oh, go ahead, sir. I'm sorry.
Let me just ask, one thing I think in our education and discussion, see if you can't get people to make sure they cover both their mouth and nose with the mask. A lot of people, for some reason, tend to just cover their mouth. They don't know, and not the nose. So, you know, make sure our people understand that, the importance of that.
Yes, Mr. Chairman, that's clearly in our policies and the signage that we have on the buses and at Comet Central, big signage that says your face covered or mask must cover your nose and mouth. And I believe our drivers, and Joe can attest to that, they're enforcing that policy.
Very good. Thank you much. Okay.
So on the next item, 7B, you requested, Mr. Chairman, an update on driver barriers and the potential for digital thermometers. Some background, as you know, since March 17, we've been fare-free due to concerns associated with fare collection and having that proper separation between bus operators and passengers. Presently, passengers still board from the rear door, and to protect the bus operator from the passengers, we've also put a chain at the wheel wells of the buses to further that separation. Per previous board action, this will continue until the governor's state of emergency ends, as well as the installation of driver barriers. And I just want to make sure it's clear that to address the deficit in fare collection, we are using CARES Act funding to pay for our operations and maintenance of services. So there is no, in theory, loss to the comment by taking this action. So on July 10th, after we met, based on your endorsement and using the executive director's authority within our procurement and contract administration policy, I've issued 3 purchase orders for the installation of driver barriers on our entire fleet. The largest purchase order went to New Flyer for installation on the big transit buses. Another purchase order went to Creative Bus Sales for installation of barriers on the cutaway buses. And another purchase order went to Alliance for installation of barriers on the 2 new low-floor cutaways that we just had delivered to us. In addition, we're also putting barriers in our minivan. For a timeline, in relation to New Flyer, the expectation, as page 77 states, will be 8 to 9 weeks from the end of next week for installation. After the prototype, it will be another 8 to 9 weeks, so December 21st to begin production installation. And they anticipate that hopefully by January 4th or January 11th, the entire big bus fleet will have driver barriers. Any questions on that first portion?
No, that sounds good.
Not for me.
The university buses that were delivered to us, the 5 from the Regional Transportation Commission of Southern Nevada, already have driver barriers in place. So if you would like to come down and take a look at what a driver barrier looks like, feel free, and we'll be happy to show those to you. And just as you know, these driver barriers are not only barriers to protect operators from passenger interaction, but they're also assault barriers to prevent drivers from being assaulted by passengers with a locking door and a sliding bulletproof window. On the cutaway, I'm sorry, go ahead.
Go ahead. That's great. Go ahead. Go ahead.
On the cutaway buses, we're having a little challenge, so there is a delay on that. The Gen Fare box is mounted behind the driver in a location that we do not have a barrier for. The engineering department is working on a solution, but I've not confirmed a barrier that works. They have suggested that we move the fare box towards the passenger entry door. Our challenge with doing their suggestion is that it's going to create ADA concerns. You have to have so many feet as the passengers are coming up the stairwell of these buses to get into the aisleway of the buses. So we can't, because of the way those cutaway buses are designed, and we have 40 of those, 19 of them on the fixed route side, 21 of them on the DART side, we can't move the fare box. So their engineering team is working on a solution. For the interim, what we've done is we blocked the first row of seats behind the driver, just to ensure that we have that proper distancing. And Joe, you're still on the line?
Yeah, I'm here.
Do we have an update on the shower curtains from maintenance and getting those on the cutaway buses?
Let's see here. I have to get with Ronnie on that to see what the status is.
If you don't mind getting that update, so we can share with the committee, I appreciate that. So for the interim, we have authorized purchase orders under TransDev to purchase PVC pipe and shower curtains to at least separate the driver until we can get a proper durable assault type barrier on these cutaway buses. So we are working on that, but it will take a little longer than we anticipated. However, the minivan barriers will be installed this month. Any questions on the cutaways of the minivan?
None
Not
for me.
Mm-hmm.
All right, Mr. Leaks, I know we've gone back and forth on the thermometers on the buses, and I'm proud to say that finally an appropriate thermometer has been developed, as shown on page 78 of your packet, that potentially could work on transit buses that won't result in any additional operational costs, i.e. hiring a person to do these tests. We have requested a demonstration of one of these thermometers to see how it can work. If it works out great, we will, of course, through our procurement process, need to find 2 additional vendors that can do this work. If not, then we can do a sole source procurement under Executive Director's authority. But I would like to have an endorsement from the committee before I use that authority, just because of the high nature of the cost to do so. We would have to purchase 137 units. 50 buses would have 2 units because we have 2 doors, and 37 buses would have 1 unit. That would be at a price of $795 per unit. Regular price is $1,095. Total hardware cost would be about $108,915. The installation cost for 137 units would be about $10,275, for a grand total for this project to be $119,190. We don't have this project budgeted, so with the committee's endorsement, we will work to find funding and then work through the finance committee to identify what line item of the budget this could be charged to, and then go through those appropriate channels for approval.
So, John, did you say that this would be covered by our CARES Act funding? Did you say that cost would be covered by?
No, our CARES Act is committed right now, so we'll have to work within our existing budget to make it work. And we will take the time to see if we can find $119,000 or $120,000 to pay for this project if the test proves successful and this committee endorses us to buy those thermometers.
So really what you're asking of us is whether that would be, we see that as a desirable feature to have if we can manage it fiscally?
Correct, and after the success of a test.
So
well, let's talk about, excuse me, Leo, let's talk about this a little bit, John. Now, I mean, when I first came out with this idea, we were just beginning to go into this pandemic. I'm wondering now, after all this time, and look like with the implementation of the mask, required mandatory masking, we haven't had any. Have we had any positive cases?
We had one positive case with an employee, but it did not occur at work. It occurred during that employee's private time. That employee did quarantine and I believe is back to work. But Joe, any comments on that? Any other further things that you may be aware of from passengers or employees?
No, sir.
I tell you what my reservations are.
What? Go ahead. One follow-up
want me to
on
say?
that, Leo.
Okay. Let them finish. Sure.
The follow-up on it, if we were to install these, and passengers decided that the alarm went off and they decided that I'm gonna get on anyway. What kind of problem do you see that creating? Because somebody, I guarantee you, somebody would do that. What
So
would
we
do
would
in
have
that?
to amend the policy that this committee and the board adopted to add in a paragraph that if the thermometer goes off, that the passenger would not be allowed to board the bus. And if the passenger disputes, then similar to the mask policy, the bus doesn't move, the driver gets off the bus and calls dispatch for supervisory or police or sheriff's assistance.
Okay, final question, then you, Lil. Based
Okay.
on our history up to this point, do you think, does this appear to still be a good expenditure of funds under the circumstance? We hadn't had very many cases. We hadn't had it but one case, really. None, and people wearing masks. I don't know. What do you think? Do you think this is a good expenditure of funds for that much money?
In light of just, as you know, as you heard me talk previously, just we're living in a unique environment right now, and money is paramount. Sales tax is still down, federal funds, the federal government has still not provided another bailout package for transit. I believe it's a good use of funds, but I don't know if it's a high priority in needing to make this expense at this time because of all the other measures that we've done. If we had additional CARES Act funding or some other funding source, or if we can get some special grants to pay for this without impacting our normal revenue sources, then I would say yes, I would be happy to go buy this tomorrow. I'm a bit reserved just because of, I'm just nervous that of just our funding sources and that we have ample funding sources to cover our base level of stuff that we need to do for this fiscal year.
Okay, Lil, you got the show.
Well, I really, John was speaking to the issue that I was, and you asked the question that I was really wanted to speak to, and here's the way I'm looking at this: is whether we'll be really gaining any added protection for our drivers and our riders by the addition of these thermometers, because what we know is that people can spread the virus with no symptoms at all. And so I don't want anybody to have a false impression that if people get on and they don't have a fever, then they are safe. I mean, because they're not. I mean, we don't know what the infection status is of every rider that gets on the bus, but what we do know is that every single person is a potential carrier of the virus because you don't have to have a symptom to spread it. So I'm like John, I am reluctant to make this kind of expenditure when, in fact, all that we can do to protect our riders is the biggest thing we can do is to have people wear masks, because if they are infectious with or without symptoms, that will help to stop the spread. The thermometer, it seems to me, doesn't really add to our ability to protect people. I'll just say it that way. I mean, you and I know that people can have fever from all kinds of things, and so I think we may be getting into a more complex situation than seems warranted in terms of really adding to rider protection.
Yep, I agree.
So
What
I
you got to say
would
about
caution against this. I would caution against this expenditure.
Okay. Well, all right. Any other comments on that, John?
I mean, I'm still happy to do a test and the vendor has agreed to give us one at no cost, and we can just try it out and just see, and I'll be happy to share the results. But at this time, I'm not really asking for action unless you want to give me action. But I'd say at least let's test it out, see what happens, and if we are able to find a special funding source to pay for it, I'll come back with a recommendation for this committee to consider.
The only thing I would ask about that, Mr. Chairman, is if we're running tests on it, is that raising the expectations that we think this is an essential thing to have, and that we're just going to not do it if we don't think that we have the money? I mean, I don't want to even give the appearance that we would be withholding something that really is protective, but I don't see that we would be.
Yeah. Well, I tell you what, in this.
Oh, I'm sorry. Go ahead.
Go ahead, John.
I was just going to say, I don't know if we'll be necessarily raising expectations, because we'll just put it on one bus, and we won't necessarily have a policy for it. We'll just see how it works out. And if we hear that alarm, for instance, of course it will create a heightened concern where we'll bring the supervisor, but I don't see us taking formal action per se.
I just don't want us to create a problem rather than solve a problem. And right now I can't see clearly that putting it a one-on-one bus is gonna help us with any kind of decision making. I mean, all we'd be doing is testing whether the thing measured people's temperature, which I don't see how that's going to give us. I don't see what advantage that gives us as a operating system, or to our riders, or to our drivers. I have a lot of reservations about this.
Well, I tell you what, then, do you want to just go ahead and make a motion that we put this on hold or something to that effect, Leo?
Yes, if that's the proper way to do it, I would say that we just hold off on any action on thermometers on buses for the present.
Okay, yeah, I would appreciate that motion, because then that at least it dispenses this issue that has been presented in the past until a future date that this committee determines it is appropriate for us to have that action taken.
Okay. Paige, will you read Ms. Leo's motion, please?
Yes, sir. Hold off on any action for thermometers at this point.
Thermometers on buses. And I would always encourage the staff, John and the staff, to have conversations with the public health experts that they are collaborating with, to see if any of them think that this is a measure that would be important to the protection of the public.
Well, let's go ahead and finish that motion first. So that's your motion, Leo?
That's really a discussion. That's really part of my discussion of that motion. Yes.
Okay. So the motion was to. Okay, you read it right. Okay. Well, I'm going to go ahead and second Leo's motion. Now we'll go ahead and vote on it. Will you do a roll call for me, Paige, please?
Yes,
yeah, and let me just clarify, Mr. Lee, that that my motion to hold off on any further pursuing installation of thermometers on the bus for the present. That's my motion. And then my discussion is that I just want to clarify that I don't mean that we want to stop talking with our public health experts to see if they have any indication that this is a direction that is would be essential.
Okay, I think the proper way to do that, I'm not that good on Robert's rules, but I think the proper way to do that is to go ahead, take your motion, get a second, and then ask for a discussion.
I thought that's where we were. I thought that's where we were, sorry.
Okay, so I second that. That was the discussion. Okay, now let's go ahead and vote on it.
Right.
Paige, do a roll call for me.
Okay, Colonel Lee?
I agree. Yes.
Ms. Mood?
Yes.
Okay.
Mr. Huggins?
Properly moved. Okay, thank you for the motion passed, John. So that's what we'll do with that. Okay. Any other points of discussion?
No other business at this time, Mr. Chairman.
I make a motion to adjourn.
I second that. Thank you. All in favor, let it be known by saying aye.
Aye.
Aye. Okay, thank you. All right.
Thank you. See you later.
Thank you.
Bye-bye.